There's a part of your body you rarely talk about. You barely check it, you never thank it, until it fails you. It has the power to build intimacy or break your confidence. And when it begins to suffer, you may not even notice, until it's too late. In some countries, this body part is taken away by disease. In others, it silently causes shame behind closed doors. But what if I told you that simple, everyday habits could protect it, even save your life? Let's talk about the care tips you were never taught, but desperately need to know. And yes, by the end, you'll see why this is about much more than just sex. Here are essential penis care tips every man should know. And if you think you're too young or too old to listen, this might just save your life. 1. Personal hygiene, your first line of defense. Let's begin with the one thing so simple, yet so often neglected: cleanliness. It sounds basic, obvious even. But truth be told, many men treat the hygiene of their most intimate area like an afterthought, until something goes horribly wrong. What you may not know is that poor personal hygiene is a silent contributor to infections, inflammation, foul odor, and even cancer. Yes, cancer. The shocking truth. According to the World Health Organization, in parts of rural South America, India, and Africa, where access to clean water and hygiene education is limited, the rate of penile cancer is up to 10 times higher than in developed regions. The connection? Smegma, a thick, white, foul-smelling secretion made of dead skin cells and oils that accumulates under the foreskin. If not cleaned regularly, it becomes a breeding ground for bacteria, viruses, and even cancer-causing agents like HPV, human papillomavirus. It doesn't matter your background, income, or age. If you're not cleaning properly, you're inviting infection. Expert insight. Dr. David, urologist. About 70% of the penile issues I treat, from rashes to infections and even early signs of cancer, can be traced to poor hygiene. And what's saddest is, these are entirely preventable. Daily washing with a neutral soap, cleaning under the foreskin if uncircumcised, and drying properly after can literally save a life. Real-life story. The price of ignorance. Samuel, 47, was a sharp-dressed banker in. He thought he had everything under control, but for months he ignored a small sore at the base of his shaft. It didn't hurt much, so he assumed it was nothing. Life was busy. He was managing clients, deadlines, and raising 3 kids. By the time he saw a doctor, the sore had become an open wound. Diagnosis: squamous cell carcinoma, penile cancer. He underwent surgery, lost part of his penis. But what he regrets most isn't the surgery. It's the silence. If I had spoken up sooner, if I had known what I was looking at, I wouldn't be living like this today. Samuel now travels to schools and men's groups, educating young men about hygiene, something he once saw as private business. Quick hygiene tips: simple but life-saving use, neutral, fragrance-free soap. Avoid harsh perfumed soaps or antiseptics that can irritate the sensitive skin. Stick with gentle, pH-balanced options. Clean under the foreskin, if uncircumcised. Pull it back gently during your bath. Rinse away any white buildup, smegma. This takes seconds, but could prevent months of painful treatment. Dry thoroughly after washing. Moisture is the enemy. Fungi and bacteria thrive in damp areas. Use a soft towel and don't rush this step. Wear clean, breathable underwear. Cotton is king. It allows airflow and absorbs sweat. Avoid tight, synthetic fabrics that trap moisture and cause friction. The bigger picture: hygiene is health. Personal hygiene isn't just about being fresh. It's about respecting your body, preventing disease, and protecting the people you're intimate with. It's not a woman's job to remind you. It's not your doctor's job to notice too late. It's yours. Cleanliness isn't vanity, it's power. It's a statement that you value yourself. And when you look at it that way, you realize that taking those few minutes each day isn't a chore. It's a life-saving routine. 2. Keep the penis active. Oxygen matters. There's something no one ever tells you as a man. Disuse is dangerous. Just like your arms will weaken if you stop lifting, or your lungs will struggle if you stop breathing deeply. This part of your body also requires movement. It needs oxygen, it needs circulation, it needs activity, or it slowly begins to break down. Quietly. The science of stillness. What many don't realize is that your penis is a vascular organ, made mostly of sponge-like tissue filled with blood vessels. Its health depends on the regular flow of oxygen-rich blood. Scientific insight. On average, healthy men experience 3 to 5 spontaneous erections during sleep, even without sexual dreams or stimulation. This natural process is called nocturnal penile tumescence. Dr. Emily Harris, urologist, explains, "These nighttime erections are the body's way of keeping the tissues oxygenated and functional. When this stops happening, either due to aging, stress, or medical conditions, the tissues can begin to shrink or harden. We call this fibrosis, and it's often irreversible." Isaac, a 59-year-old retired civil servant, had been celibate for nearly 6 years. No sexual activity, no stimulation, not even much interest. When he met someone new and finally decided to reconnect intimately, nothing worked. No erection, no sensation, just silence. After several tests, his doctors found that atrophic changes had begun, the tissues had thinned, and blood flow had significantly reduced. "I wish someone had told me that the body needs practice, even for this," he later said, with a voice heavy with regret. Why this matters, even if you're not sexually active. This isn't just about libido. It's not about whether you're married, dating, or celibate. This is about health, circulation, prevention, longevity. Without regular use, your penile tissues become starved of oxygen. Over time, this increases your risk for erectile dysfunction, ED, reduced sensitivity, tissue damage, psychological distress. What you can do: reignite, restore, reconnect. Stay sexually active, partnered or solo. Regular sexual activity, even masturbation, promotes healthy blood flow and hormonal balance. Avoid excessive pornography. Your brain and body are linked. Imagine this. You walk into a room. The person you've dreamt about is right in front of you, smiling, warm, willing. But you feel nothing. No spark, no arousal, just emptiness. This is not a scene from a sad movie. This is the reality for many men today, men whose bodies are awake, but whose brains have been rewired by porn. Porn, the modern epidemic in disguise. Let's be honest, porn is everywhere. It's free, it's fast, it's available 24/7 in the palm of your hand. And at first it seems harmless, even exciting. But behind the scenes, something deeper happens. Your brain begins to change. Research from Cambridge University confirms that compulsive pornography consumption rewires the brain's reward system. The dopamine released during porn use is intense and instant, far more exaggerated than what real-life intimacy provides. Over time, the brain starts craving the screen, not the touch. It begins to associate arousal with pixels, not people. DJ Lisa Moretti, certified sex therapist. Porn, in moderation, isn't evil, but when it becomes your main source of stimulation, the brain adapts. Real intimacy begins to feel boring. This leads to performance anxiety, loss of interest, and in many cases, porn-induced erectile dysfunction, a growing issue in young men under 30. Michael, 28, a tech worker, had always been confident around women. He wasn't shy. He dated often. But something changed. He met a girl he liked. They connected emotionally, but when it came time to be intimate, he froze. No erection, no excitement, just blank. Confused, he visited a doctor. Blood work, normal, hormones, balanced, physically, healthy. Then the question came, how often do you watch porn? His answer, 3 hours a day, every day, for the past 5 years. I didn't realize I was training my body not to respond to real touch, Michael said. The diagnosis was clear: porn-induced sexual dysfunction. It took months of digital detox therapy and real connection for Michael to feel intimacy again. 4. Seek help without shame. There's no weakness in reaching out. Many men are silently struggling with this. Therapists, online recovery communities, and support groups are safe spaces to heal and grow. Talk about manhood like it's about power, but real manhood, it's about responsibility. And nothing says responsibility louder than taking care of your body, even the parts people don't see. Check in with yourself today. Wash, examine, protect. Book that test. Talk to your partner. Ask your doctor questions you've never dared to ask, because caring for your penis is caring for your future. Subscribe for more real talk on men's health, and if this helped you, share it. You might just save a brother's life.